My relationship with KU is a very personal one. It started about 12 years ago when my father was here being treated with cancer. I think, you know, if you've ever had a loved one diagnosed or been diagnosed with cancer, when you hear those words, your brain goes into lockdown. In our discussions with KU, we kind of massaged what we felt was missing.
They wanted to know about our cancer program and understand what our needs were. And we met with Terry Bamman, who was our one and only lead nurse navigator.
So his disto scheduled already. That's perfect. Okay.
We're their primary nurse, the first person that they talk to here at the program, and we stay with them, virtually holding their hand throughout their journey at KU.
Well, if you have questions, though, you just call me, okay?
The program touches so many people.
It does.
And it goes all the way through the patient, the family, the relatives, friends.
It's really been an important aspect of how we're trying to improve the patient experience at the University of Kansas Cancer Center, and how we make each treatment and each welcome and each interaction we have a very personal one for each patient.
That sounds good, and I'll give him a call and we'll get him set up next week.
What a lot of people don't realize is that nurse navigation's not covered by insurance, and it's expensive to have 13 full-time disease-specific nurse navigators.
I think the nurse navigation program that they really helped us initiate with their first major gift really made such an impact on our patients, and they were able to see that impact so quickly, which was the reason they decided to invest more in the program.
We came back to kind of get a status report, and we walked away from that meeting with chills, like, holy cow, you know, look,
They listened.
Look
and they
what
actually
they
did
did. And honestly, we got a little more involved and added a little more to the program.
And afterwards is when Teresa was diagnosed with cancer.
Then it all kicked in, and unfortunately, but fortunately,
And
we went through the program.
It's a heck of a program. I mean, we don't want anybody to use it if they don't need it, but if you need it, it's very comforting.
It is.
Oftentimes people will say the nurse navigators like angels. And I can't think of a better way of describing what they do every day.
It's also tremendously rewarding for us as nurses, because that is such a high anxiety time in the life of the patient and their caregivers, that if we can make any difference at all for them and help alleviate that stress, then we've done our job.
It's an essential and important part of an invaluable process that each patient that comes to the University of Kansas Cancer Center deserves.
Teresa and Tom Walsh are unique individuals. They are not only very passionate individuals, they believe in a cause, they invest in a cause, and they are involved in the cause. They truly define this award category.
I am very passionate about this hospital because I'm very passionate about our community. And this is our family here. This is our neighbors and our loved ones, and we deserve to have the high quality health care that we have here.
It's a world-class institution. We just need to be...
More people just need to know.
Yeah, we need to be louder about it and tell more and get a little bigger, because more people need the care.